Plato said that you can discover more about a person in an hour of play than in a year of conversation. Even very young children use their natural language, play, to communicate and resolve troubling issues. Dr. Morgan, tell us a little bit about what we're going to see today.
We are privileged to talk with Sherry Michelin, Director of Crossroads Family Counseling Center, about play therapy, for which she is a certified provider. Listen for the word safe, which is the important climate necessary to provide child as well as adult psychotherapy to be successful. Today you will get an opportunity to view the center's offices, which are filled with figurines, games, paints, and sand tables, which are used in the work with children as well as adults.
This is Lee Morgan and Dr. Patricia Morgan, and welcome to Spotlight on Mental Health.
Sherry, thank you for being with us. Could you tell us what play therapy is?
Play therapy is a type of treatment for children and adolescents and adults. Anyone can use it, but it's a symbolic way of letting children, particularly, be able to express their thoughts and feelings in a way that it comes natural to them. So a child often can't come in and sit on a couch and say, I'm mad at my mom, or I'm mad at my teacher, or whatever's going on in their world. But they can come in and they use the toys in a way that demonstrates how they feel and what's going on in their life. And so it helps them have a sense of resolution. It helps them to have a way to learn and grow through the toys and play. And then to have a play therapist there in the room is a way to create a safe environment that children can express things in a way that they may not be able to in their world.
Sherry, talk a little bit about adults, how adults use play therapy.
So adults, you can use play therapy in ways that similar to children, in that it's a nonverbal way of expressing themselves. So if an adult comes in and they have trouble talking about something, or can't process it, they may do it through drawing or art, or they may use some of the symbols in the office to be able to express a way they're feeling or thinking about something in a way, because it's using the right part of the brain, which is our nonverbal part of our brain, and it's our way our emotions are held. And so sometimes adults can't clearly get it out, and so this is a way that they can, in a way that's in a safe place and non-judgmental way.
How is play therapy different than playing with your child?
In play therapy, in our offices, we have specific toys that have been selected that have different symbolic meaning. So we have toys that maybe are for nurturing play, toys that are for maybe more aggressive play, toys that are for mastery. And so it's different in that the child comes in and we give them the safe place to go towards any toys they want to play with. And we don't direct the play, we let them direct the play. And so we just participate. At home, oftentimes parents are playing with their children, but then, it's a different environment. They don't have all the toys that we do in terms of what we're looking for. But also a lot of times parents are, working on maybe manners or, good behavior. And so they're giving them a lot of instruction, or maybe they're influencing the play in a way that they don't mean to, but, they're just playing with their child. So play therapy, we give the child a safe place to come in and do whatever they want in this room. So a child often will come in and say maybe they have something on their mind, and they'll go directly to a toy. It's like I had a little child that was having some surgery done, and so he came in and I never said what's going on. He just came in and he immediately went to the hospital and started playing out the hospital with an ambulance and getting the surgery stuff out. And so he was able to work through some of the emotions and feelings that he was having about something going on in his life.
Mm-hmm. Who benefits from play therapy?
Any type of issue that's really going on with a child or a teen or adult can benefit from play therapy. But oftentimes we see kids that have anxiety, or maybe they have attention deficit disorder. We have kids that, maybe their parents are divorcing and they can't, openly talk about what's going on at home. We have kids that are having medical issues going on. We have kids that have had trauma in their lives, which is really hard to talk about. And so a wide variety of issues can be addressed in play therapy. We have children that have a lot of often complex issues, and so they may have multiple providers working with them. So we have kids that are in occupational therapy or physical therapy, speech therapy, and so they may come to us to help with supporting the work that they're doing in those therapies. But so they may have sensory processing disorder, and so we work on the emotional piece of that while they may be working on the physical piece in occupational therapy. So, a wide variety of issues, children on the autism spectrum. So we work with anybody can use play therapy.
Sherry, I'm sure that parents particularly would be interested in the process that they would be going through when they want to use your agency for their child.
Typically for children 12 and under, we like to meet with the parents first. And so we do a background information and get all that intake information and talk about the things that the child might be struggling with without the child in the room, because we want to, honor those children. And then the next session, we would have the child come into the room with the parent, and then we introduce them to the playroom and then have the parents leave. If the child's maybe having some separation issues, we might allow the parent to stay in the room because we want to make sure that child feels safe and that they're supported in the work they're doing. But after that, we would meet individually with the child for several sessions, and then we have a parent session where we will have them come back and we talk about what we're seeing in the play therapy, what kind of themes are coming up or what kind of issues that we're seeing, and then how the parents can help support the children at home and with the work that they're doing. Sometimes we may have the parents come into play sessions and we will work with them together because we maybe want to teach some of the parents some of the skills that we're teaching children, and then have them do that at home. So parents are often very involved in our sessions because we want them to be, they're a critical part of the work we're doing.
What are the different types of play therapy?
There's many types of play therapy. The most common is called child-centered play therapy, and that's with young children where they come into the playroom and they are told that they can do almost anything they want in that room, and then they will be told what they can't. And so it gives the child a sense of freedom to play and do whatever they need to do in their room. And the therapist is there, helping them and tracking them with what they're playing. Another type of play therapy is a more directive play therapy, where the therapist will then maybe have an activity specific that they want them to do, or a game, or maybe some bibliotherapy, a book about reading about anxiety or learning coping skills. Then we also have what we call sand play, where we have a sand tray with sand in it, and kids can create a world in the sand. And that's metaphorically, they place a lot of symbols into the sand and build a world. A lot of times the kids like to play in the sand too as well, because it's very soothing and calming. TheraPlay is a type of play therapy that is attachment based, and so it's working on building and strengthening the parent-child relationship. Another type of play therapy that involves the parents is called filial therapy, where the therapist teaches the parents basically how to be kind of a child play therapist with their child, and so it's working on building that relationship with them. And then we also use art therapy, and we use a lot of bibliotherapy as well. So there's many different types. And the therapist will find, after the assessment and the intake, which type they feel is best for the child, and then they'll talk to the parents about how to incorporate that into the treatment plan.
I think it would be interesting for people to hear about play therapy used for attachment issues. If you could give an example of that kind of therapy that you have experienced.
Attachment therapy that I use is called TheraPlay, and I've been trained in the TheraPlay process. And it's really based on working with the parent and child and using their interactions to build the relationship. I've really believe in early attachment and that basis to help them prevent long-term problems as children get into adolescence. So I've worked with several kids and families, and a couple cases that come to mind is I worked with a little boy that was born prematurely, and he was in the NICU for 3 months. And so obviously that disrupted that parent-child bond, and he had a very medically complicated case. And so afterwards, his parents were very focused on, his survival and helping him to get the medical needs that he did. So he came to me when he was about 6. And then that's when we were able to really start working on building the attachment between him and his mother. And it went beautifully. And so they have a really good relationship. And not that they didn't, because it was obviously a very caring and concerned mother. And but we needed to go back and rebuild some of the things that were missed from the very beginning. I've also worked with kids that have been adopted and foster care, and recently worked with a little girl that had been in multiple foster homes since she was 18 months old. And she was adopted by a single mother who was a wonderful woman who was a kindergarten teacher. And so this little girl didn't trust adults and had not had success in therapy before. The therapist I talked with before she worked with was like, she is not capable of attaching. And so I brought them in and we did TheraPlay and worked on building that. And this little girl really had to learn that this mom was going to take care of her and that she could trust her to take care of her. And it was just so beautiful to watch that relationship bloom and blossom in this little girl, to learn that, it's okay for me to be a little kid and be taken care of, and that I can trust this, that I am going to be taken care of.
People that watch our program, I always try to give them some understanding of the people that do the work that we're filming. How did you get involved in doing play therapy?
Originally, I started working with adolescents, and I found that when I would sit and talk with them, they didn't want to talk, and so they were resistant or they didn't want to be in therapy. So I started playing cards with them, and I found that by having an activity or something that was a distraction, sometimes they would open up a little bit more. And then I would start throwing in things like playing Uno cards with a feeling. So if you put a red card down, you had to talk about a time you were mad, yellow happy, blue sad. And so then they would start telling me things, and I got information out of them, and they didn't feel like it was their traditional therapy. And then I ended up working and had the privilege of working with Eliana Gill, and she taught me about that play therapy is more than just playing games. So then I started doing my training towards my play therapy and getting my credentials. And then I had my own children, so I learned a lot about play through them, and observing the play and looking at what they were doing, which was fascinating. And so then I really got interested in working with little kids and learning more about them and the play. And now I can't imagine doing any kind of therapy with children without play therapy.
Sherry, how do you include parents and caregivers in the process of play therapy?
Parents are a critical part of play therapy. We involve the parents in parent meetings and talk about what we're seeing in the playroom and find out what's going on at home and in school and how we can incorporate that. And we involve the parents in play sessions at times. We have them come in at the end of sessions to maybe teach them tools that their children are learning. But sometimes it's really hard for parents because they are not in the room and they don't see what's going on and know. And so it's really hard for them to trust the process, that their kid's learning something or that they're gaining, some skills. And so, we have to always work with the parents to talk about that. We'll talk with them outside the session, but, this is your child's special time, and you need to honor that. And so that can be very hard for parents. But we like to include the parents as much as we can, so we talk with them outside sessions and, have monthly check-in meetings with them.
Sherry, I know the work that you do requires a great deal of training and supervision and certifications. Could you talk about that?
To become a registered play therapist, you have to have a license in the state that you practice as a mental health practitioner. And then after you get your license, you need to do 150 hours of continuing education that is particular to play therapy and learning about all different types of play therapy. And then there's 500 hours of actual clinical work of doing the work with children while you're under supervision. So it's quite an extensive process to get trained as a registered play therapist. And then I'm a registered play therapy supervisor, so then I had to do extra work and training in that as well.
Could you demonstrate for us some of the tools that you do use in your work? I'm sure everyone would be interested to see that.
So in the playroom, we have different types of toys that are symbolic of different needs or issues that children need to work through, such as we have toys with trains and blocks, and those are more mastery toys where kids can work through issues of trying to, feel competent and feel like they, can do something. Then we have toys that are more your fantasy type of toys where they can work through different issues of good guys versus bad guys, evil and good. Then we have more your nurturing toys, which, maybe being taken care of, so they take care of babies. And then we have, food is always very nurturing. So we have a kitchen, with nurturing. And so kids will prepare meals and, feed people. And then we have some aggressive toys. So kids can work through some of their anger and feelings, like handcuffs. Those are one of the more popular toys in the playroom. And then we have the sand tray. And the sand tray, as I explained, is symbolic of, it's based on Jungian theory of kids having images that they can project out. And it is a way for them to express their thoughts and feelings. And so they can put this in the sand and create worlds. So I've had kids come in my office and that maybe their parents are getting divorced, and I'll say, how do you feel about your parents getting divorced? And they just shrug or say nothing. And then they will go and create a scene in the sand of a wedding scene. Because what do all kids want? Is that they want their parents to stay married and want them to be together. So, they're able to express this deep inner feeling that they maybe can't in a way that is safe and is contained and, can help them to process and work through that.
Sherry, how do you work with children that don't want to play?
How we work with kids that may not want to play is that play therapy is a way for kids to come in and express how they're feeling and thinking. And so if they don't want to play, that's okay. They don't have to play with the toys. The toys are, tools to help them get done the work that they need to do. But if they don't need the toys to do that, then that's okay. They can sit and talk, or we can, draw or read books that are, pertain to different subjects. But we let the child, guide what they need. And we believe that children innately kind of know what they need to do and how they can get their needs met through the therapeutic process.
Spotlight on Mental Health would like to present a pre-recorded program regarding play therapy. It shows Dr. Heather Thompson, PhD, conducting a session of various types of play therapy with a small child, and we hope you enjoy it.
In this segment of a session with a young boy, you'll notice me using several play therapy-based techniques. In the first few minutes in particular, you'll notice me working to facilitate esteem and offer encouragement. And I do this to promote a felt sense of self-efficacy. And you'll notice that I acknowledge and reinforce the process or the effort rather than praising the product. You're thinking you might need some help getting that in there.
It's gonna hold.
Oh, you know where it goes. You got it in there. You didn't even need my help. Okay, and then that.
Help me.
You need some help. Let's see. Okay, got that in there like that. You knew that went in there.
I need help. This.
Okay, and you need help with something else. There was something else that you weren't sure about.
This help. This.
You need help with that part right there.
Yeah.
Okay. Let's see if we can get that. Kind of tricky. Focusing. You got it. You smiled.
Tell me.
Okay. You've got something else in mind you want to do. Just checking it out.
This goes the other way.
Oh, you think it goes the other way. Okay. Pushing that like that. Bump into it. Oh!
Let Mom do it.
Oh, you'd like for me to wear that. All right. Got it on now.
Tell me.
Okay. All in there. It's hard to do. It's hard to get them to all go in there.
I did it.
You did it. It was hard, but it didn't stop you.
I did it.
You did it, and you're proud.
Tell me.
Okay, you'd like some help.
This goes in there.
Okay, you know that. You know that that part goes in there. Okay, you're squeezing it together, getting it in there. Okay. All right, you're giving this to me. Got that again.
Do you know what? No.
Oh, you want that one too.
I get. Oh. Down there.
Okay. Can put that right there. In this segment of the session, you'll see that the young boy tries to leave the room, and what you'll notice is that I work to maintain the structure of the session while at the same time acknowledging his wants and feelings.
Want some milk?
Oh, you're feeling thirsty. Well, we can get some milk in 10 more minutes. In 10 more minutes, it'll be time to get some milk.
Want some milk?
We'll get some milk in 10 more minutes, Preston. I'll let you know when we're almost done. I'll let you know when we're almost done.
I want this.
You like that? You like those.
I'll be still.
Put those there. You found something right there.
Do this.
Oh, you can do that. Ooh, it made a sound. In this segment of the session, you'll hear me reflecting feelings. And I do this not only for him to feel understood, but also to help him develop an emotional vocabulary so that he can begin to self-identify what it is that he's feeling. Not making any more sounds.
Mommy.
Oh, you're disappointed. Now you're happy. It's working.
I hear you.
How are you?
Oh,
That's fine.
I'm having.
Well, you would like for me to have that. You were having fun with it, and you want for me to have that. Ooh, you heard that. My chair made a noise. Aww.
This.
Moving those over. Ah, something's piqued your interest. Open that on there, and that one on there. Yeah,
Walking on me.
both of them are on there. Putting that one right there. And that one right there. Okay, move those. Put them someplace else. Oh, you're bringing these to me. Okay, got
Sherry, when I ask questions that really aren't prepared, it really shows your passion for your work. That really comes through when we talk about other things that we didn't really think we would talk about, but your passion for your work, and you would have to have passion for your work because it's not easy work.
I do feel very passionate about working with children and adolescents and families and play therapy. And I believe play therapy gives them this opportunity to be able to work through the problems and issues and worries that they have in a way that they can't in other settings of their lives. And so I really do believe in this work and the process of it. And I've seen so many kids benefit from it that it makes me feel really, really blessed to be a part of this process.
Sherry, thank you so much for this presentation. Play therapy is so important, particularly for prevention, but also to help children that are really struggling emotionally. And you know, if they didn't have this service, my heavens, what would happen to them? So thank you so much for showing us your tools and talking about what you do, and perhaps we can do more with regard to your agency.
That's our show today. We thank you for joining us on Spotlight on Mental Health. We'll see you next month. And everyone, have good mental health.